delivering that order to the facility, wherever it's going, and making sure that that order is complete, making sure it's got the CPT codes, it's got the diagnosis code, that you've got all of the patient information readily available for that facility if they're obtaining the auth, so they have all of that information. Coming in a close second to that is making sure that your clinical documentation is signed off. There are some insurance companies or some TPAs who process authorizations that are diagnosis driven. So you can go ahead and go in there and put in that CPT and that specific diagnosis code, and you may get an immediate approval. But what we're seeing now with a lot of TPAs is you're seeing less of that diagnosis driven approval and more of a clinical pathway. It's so important that that clinical documentation, if you have a stat order, when that patient walks out the door, you want to make sure that that clinical note is signed off so that authorization request can be initiated immediately